Good morning everyone. Myself, I am Dr. Gowtam Mukhesh, Senior Resident, Department of Neurology, Narayanamedicalcollege. In India, November 17th is observed every year as National Epilepsy Day to create awareness about epilepsy and its management to the patients, bystanders and also the caregivers. Epilepsy, which is nothing but sometimes called as seizure disorder, which is characterized by recurrent episodes of seizures, usually called as fits. These fits are caused by excessive sudden electrical discharges from the neurons, that is the brain cells. Seizures are the main sign of epilepsy. Some seizures can look like staring spells and others can make the patient to fall, the patient can shake and some may lose awareness from the surroundings and others can be confused as well. A person who has seizures for the first time should immediately consult a primary health care provider. Normally, the primary health providers are the first persons to be seen and then the neurologists come into the picture for the specialist opinion. Patients need to learn what to do to avoid the recurrence of these fits and to keep an active life, like taking their medicines regularly and keeping or maintaining records of their seizures and recognizing the triggers of their fits and having a good sleep and also mainly to reduce their stress. People working at risky areas like at heights or near water or fire should be more cautious, as during their workplaces or during their work times, if they get fits, they can be injured. For the bystanders, always remember, stay safe side. Stay with the patient if the patient is not awake until the patient is awake, and keep the patient safe, alert after the seizure, and gently roll the patient to one side if the patient is not aware or awake. Do not restrain the patient while having a seizure. Remove any harmful object or sharp object away from the patient having seizure. Patient if is having any tight neckwear, loosen them. Gently turn over the patient to one side so that any fluid in the mouth comes out slowly, and put anything soft under his or her head. Do not try to put anything in the mouth in the fear of biting or swallowing the tongue. Social burden associated with the stigma of living with epilepsy is a major hurdle than the disease itself. It can reduce economic independence through loss of productivity, unemployment or underemployment, restrictions on education, not sending them to schools, and loss of complete driving privileges, and parents of children with epilepsy isolating them from other kids, and also overt discrimination at the workplace. Women in particular living in countries like India face a lot of trouble to handle the stigma for fear of having disadvantages in marriage negotiations, parents concealing their history of epilepsy to get them married to someone, and myths that women with fits can't get pregnant or can't breastfeed, etc. If patient takes prescribed dose of medication at regular intervals and at regular times, they can get rid of these seizures. Comprehensive approach in treating a patient with epilepsy includes interventions at the levels of the individual, the family, the healthcare system as well as the public spheres. Doctors should consider the individual's social, cultural and personal interests while treating the epilepsy, and should not lose any opportunity to educate the individual as well as the family regarding the epilepsy. All epileptic patients should visit their doctors regularly, not only to know their response to the treatment but also to know the side effects related to the treatment. During this COVID times, some people might stop taking their medicines, maybe due to their stress. That should be avoided. So along with the face mask, personal hygiene and social distancing, taking the prescribed drugs should be a part and parcel of the patient's daily life. Small actions for big change. With more voices lifted together and more people knowing about epilepsy, we can create a greater change. So I wish we can pass on the information to more people and make the lives of epileptic patients as normal as possible. Thank you.